Welcome to this explainer. If you or someone you love are over 60 and navigating type 2 diabetes, listen up, because what we're diving into today could fundamentally rewrite your future. We're looking at some truly groundbreaking medical science with a wildly empowering message. You actually have the tools, and we have the clinical data, proving that you can take your health back. This doesn't have to be a lifelong sentence anymore. For decades, we were handed this really grim script. We were told this disease was a one-way street, a chronic, progressive decline, where the only option was just managing that decline with lifelong, ever-increasing doses of medication. But wow, has clinical research over the past 15 years completely shattered that myth. The new science reveals a profound truth. Type 2 diabetes is actually a reversible metabolic condition. And the best part? It's driven by factors we literally have the power to change. So here is how we are going to break it all down today. We'll start with a new paradigm, then look at the biology of reversal, examine the proof remission is real, outline the reversal protocol, and finally wrap up with medications and expectations. Let's jump right into Section 1, a new paradigm, shattering the incurable myth. Think about this massive shift in medical perspective. Type 2 diabetes is not an irreversible chronic disease. It is a metabolic condition that can be put into remission. Instead of just accepting a relentless decline, aggressive lifestyle interventions can throw this condition into complete reverse. We're talking about achieving totally normal blood sugar levels without any diabetes medications for at least 3 months. It means gaining true independence and freeing yourself from the pharmacy counter, even in your 60s and 70s. Moving to Section 2, the biology of reversal. What's actually happening? Let's pop the hood and see what's actually going on inside your body. To fix the engine, we have to recognize the two main biological roadblocks. Roadblock number 1 is insulin resistance. And I really want you to focus on the word dynamic here. You are not permanently locked into a fixed genetic fate. This is a highly dynamic state driven by things like excess visceral fat, physical inactivity, and poor sleep. And because it's dynamic, it's reversible. In fact, it can sometimes start improving within just days or weeks of making focused changes. Which brings us to roadblock number 2, explained by the famous twin cycle hypothesis out of Newcastle University. We used to think the insulin-producing beta cells in your pancreas just permanently died off as the disease got worse. But science now shows they aren't dead at all. They're essentially just suffocating under a buildup of pancreatic fat. When you achieve significant weight loss, you clear out that fat, and those beta cells basically wake back up and get right back to work secreting insulin. All right, Section 3, proof remission is real, the clinical data. That's the theory, but let's look at the hard proof. If you're sitting there thinking, okay, this sounds way too good to be true, wait until you hear the numbers from the Landmark Direct trial. This study completely revolutionized modern endocrinology. Get this. An astonishing 86% of participants who lost 15 kilograms or more, which is about 33 pounds, achieved total diabetes remission. They completely normalized their blood sugar. No meds. Let that sink in. For those who hit that weight loss target, almost 9 out of 10 reversed their condition. And caloric restriction isn't the only way to get there. The Virta Health study looked at a very low carbohydrate ketogenic diet. The results were staggering. 60% of patients achieved non-diabetic blood sugar levels at 1 year just by cutting their carbs, with a massive 94% reducing or entirely eliminating their insulin use. The data is clear, right? Remission is absolutely not a fluke. It's the expected outcome when you apply the right intervention. So, Section 4, the reversal protocol, actionable steps for over 60s. How do we actually do this? Let's break it down into daily habits. The absolute foundation here requires dropping your carbohydrates significantly. And you have 2 highly effective paths depending on what you're aiming for. If you want rapid initial blood sugar reduction, the ketogenic approach is phenomenal. That means targeting under 50 grams of carbs a day. But if you prefer something built for long-term sustainability and cardiovascular health, a modified Mediterranean approach, capping carbs at around 50 to 100 grams a day, is a fantastic evidence-based framework. But hey, diet is only half the battle. Exercise isn't just a nice little bonus. It is a direct, mechanistic intervention. You want to aim for 150 to 200 minutes of moderate aerobic activity every week. And please, whatever you do, don't skip the resistance training. Building skeletal muscle literally expands your body's storage capacity for glucose. That takes a massive continuous burden right off your poor pancreas.
Now, if hitting all those weekly gym targets sounds a bit daunting, I've got my absolute favorite easy win for you. Just take a 10 to 15-minute walk right after you eat. It is such an incredibly powerful, low-barrier tool. Clinical studies show this single, simple habit reduces post-meal blood sugar spikes by 20 to 30%. It's literally something almost every older adult can start doing today, right after your very next meal.
You can amplify all of these changes by just paying attention to the clock. Combining physical activity with time-restricted eating dramatically lowers fasting insulin. We're talking about simply delaying breakfast a bit and eating an earlier dinner, so all your meals fit within an 8 to 10-hour window. The beauty of this is its total simplicity. It naturally improves your metabolic circadian alignment and kicks off cellular repair, all without you having to obsessively count every single calorie. Finally, Section 5. Medications and Expectations. Navigating the reality check. As empowering as all this is, you absolutely have to do this in partnership with your physician, especially if you're over 60 and already taking medications. If you are on insulin or sulfonylureas, adopting a low-carb diet is going to drop your blood sugar fast. You and your doctor must proactively reduce your dosages, sometimes within the first couple of days, to avoid dangerous, severe low blood sugar, which is known as hypoglycemia. Please take that step very seriously. And as you successfully start peeling those medications away, have a strategic talk with your doctor about which ones to drop first. Interestingly, drugs like SGLT2 inhibitors might actually be kept on board the longest. Why? Because beyond just lowering your glucose, they offer incredible protection for your heart and kidneys. They are fantastic allies to have as you rebuild your metabolic health from the ground up. So, what should your realistic expectations be? Well, virtually everyone who tries this protocol is going to see massive benefits and a reduction in medications. But the clinical data tells us that complete remission is most likely if you meet a few key criteria. You're tackling this within the first 5 years of your diagnosis, you have a lower baseline HbA1c, you aren't heavily dependent on insulin yet, and crucially, you actually hit that 15-kilogram weight loss target. Those factors just give you the highest statistical probability of a total reversal. And that brings us to our final thought. The science here is absolutely undeniable. A type 2 diabetes diagnosis after 60 is no longer an incurable life sentence. Your beta cells can wake up, your insulin resistance can drop. So the only real question left is, are you ready to make the commitment and rewrite the end of your own health story? Take these findings to your doctor, map out a plan, and go take your health back.